Children need set of skills to succeed in school. Motor skills are as equally important with their visual and hearing skills. Writing, drawing, playing, and even sitting upright are just some of the everyday functions they need. When a child is having difficulty to move in the way he or she originally intended, it could affect his performance and motivation in school. This video will help you understand common behaviors of children with motor skills difficulties and the importance of conducting an assessment. We will also learn the proper procedure in conducting motor skills assessment.
There are a lot of factors that affect the motor skills. In school-age children, they all started in the womb of the mother. As you grow older, in school children, they might be affected by infection, like our polio victims, like victims of meningitis, encephalitis, or other bacterial viral infection in children. And sometimes, the manifestation of congenital anomaly is during the late stages of their development.
In assessing our students' motor skills, we will be doing or conducting movements or exercises that will help us discover their difficulties in moving the arms, legs, and the eyes. Motor skills assessment must be performed among kinder and other grade levels. Using both observational and performance techniques guarantee non-discrimination. Let us start by doing a few and quick physical examination on a child. First, ask the child to stand up. Check to see if he or she is standing properly, feet on the ground.
Okay, pagdikitin mo yung paa mo. Okay, yung kamay mo sa side.
Tell the child not to make unusual movements. Check from head to toe. Take note of any abnormalities. After that, we are now ready to check the movement of the child's arms.
May pagagawa ako sa'yo, gagayahin mo na.
Ask the child to stretch his or her left arm over the opposite side of the head, reaching for the right ear, and repeat with the right arm.
Sige nga, gawin mo anak. Yung kabila.
Without moving the head, repeat the process if necessary. If the child can do this without any difficulty, that means the child is fine. After that, ask the child to walk a few steps while standing straight, then turn and walk back. Observe if the child has balanced movement while walking. Take note if the child is not steady, stumbling, or tripping. After that, do a jumping jack. If you notice coordination or the child is able to get the hang of using both sides of the child's body while jumping, then we can say that the child is good. Now, let's do another balancing exercise. While standing straight in front of you and feet together, ask the child to stretch his or her arms forward and close his or her eyes. Tell the child not to be afraid that you are just around to catch him if necessary.
Huwag kang matakot in case na matumba ka, sasaluhin kita.
If the child is able to do this while maintaining balance, then the child passed this exercise. This time, we are now going to assess if the child has difficulty in moving his or her eyes. Prepare a pen for this assessment. Ask the child to sit upright and face looking forward. Now take your pen and instruct the child to look at the direction of the pen you're holding without moving his or her head. Move the pen to the left, to the right, and upward then downward. Observe if the eyes are moving together without the aid of the head. Teachers can also observe if the child manifests symptoms like excessive movements of the head, rereading same line or words and losing place, misreading some letters, words, and numbers, and they tend to use their fingers to point at the text or use a marker to maintain right position when copying from books. If you notice or observe any of these, he or she is subject for referral. record the child's difficulties in a particular area of the screening, and endorse the initial result to the division nurse for validation in order to make referrals and inform the parent or guardian for further diagnosis by a specialist. It would also be best for children with poor motor skills to be exempted or given minimal physical activities in school. But how about helping younger school children to develop their motor skills?
One is allowing them to move around, allowing them to join play in school, remove them from having all those gadgets, because these gadgets, what motor skills are you developing? You're just developing your thumb. Okay, and it deprives them of the needed sleep, it deprives them of the needed exercise to develop their muscles. When you detect this defect during school-age children, forefinger and the thumb cannot pick up things, it has a warning sign already, so you have to refer to rehabilitation so the child can have occupational therapy. Okay, or if the child is so clumsy or the child is moving so much, you have to refer and do some laboratory testing. We might do some therapeutic intervention.
Early and accurate assessment of children's motor skills is a vital step in making sure that children have the opportunity of experiencing joy of efficient movement and productive learning.